All right, here we go. Hello, everyone. My name is Dr. Marty Kotler. I want to thank you for watching this webinar on hygiene and HIPAA post-COVID-19. Tell you a little disclaimer here. The information in this presentation is for educational purposes. It's not intended to substitute your thorough clinical decision making. It's not intended to substitute your thorough sanitizing and disinfecting of your office policies and procedures. It's not intended to substitute your billing and coding protocols. It's not intended to be legal advice. We don't provide legal services. Every attempt has been made to make certain that the information in this presentation is 100% accurate. However, it is not guaranteed. A little bit about myself before we get started. Again, my name is Dr. Marty Kotler. I'm a chiropractor and I practiced for 16 years prior to starting my company, Target Coding. I'm also a certified professional compliance officer, certified billing and coding specialist, and my company has been helping thousands of chiropractors and their staff members for over 14 years. Now, I consider myself kind of unique because most chiropractors are not certified coders. Most certified coders are not chiropractors. So you'll see during this webinar how I combine the two specialties to make sure you're doing things properly, make sure you're complying with all state and federal laws and rules, and you're getting reimbursed what you deserve. So our guest speaker today is Christi Hudson. She's also a certified professional compliance officer. I know Christi a long time. She works for a company called Kyra Health USA. I'm sure most of you have heard of them. She's the director of business relations, and she's going to be our guest speaker today. And Kyra Health USA is one of my favorite companies. I've been recommending them for many years. I'm going to give you a little bit more information about Kyra Health USA a little bit later and tell you what my personal experience has been with them. But in the interim, I am now going to turn the presentation over to Christi. Christi, are you there?
I am here. Thank you so much, Dr. Cutler, for inviting me to be on your webinar today.
You're welcome.
So today we're going to talk about maintaining a safe clinical environment for your team and your patients. This is so incredibly important, no matter where you are on the spectrum or where your patients are on the spectrum of either thinking that it's not really a big deal to thinking that this is, the most terrifying thing that they've ever lived through in their lifetime. You have to maintain a safe clinical environment for yourself, your staff, and those patients to just give them reassurance that when they come into your office that you are taking every precaution to make sure that they're being safe. So when it comes to implementing the policy, Dr. Cutler, next slide. There are a couple of things that you need to do. So first, it starts with educating your team, and that starts with having OSHA training. It's interesting is that I've been talking about OSHA training for about the last year at state association events around the country, and the most common question or pushback that I get is, well, OSHA doesn't really apply to us. And the reality is that it always has. And then with this pandemic, we realized that it most definitely is needed in our offices today. You also want to make sure that you're educating your team on the proper cleaning and use of disinfectant. It's really funny. I don't know that prior to this pandemic if I ever actually read the directions on a can of Lysol or on Lysol wipes, but there are times, how much time it has to sit on the surface before it actually does its job and things like that. So you want to make sure that you're educating your team that it's not just wipe it off and then touch it again and keep on going, but how to properly use those supplies in your office. The next thing is PPE, personal protective equipment, when to use it, why it's necessary, and then how to dispose of it to, again, make sure that you're keeping them safe, your patients safe. So all of these things are very important, and this is a great opportunity to really sit down and make this the focus of your next team meeting. So the next thing you want to do is make sure you have the proper equipment and supplies. Clear signage with pictures for patient communication. It's one of those things that I think I've learned really quickly is that you want to make it so simple that a 6 or 7-year-old patient in your office understands proper hand washing techniques, went to tell your staff if they have any signs or symptoms of COVID-19. Make sure that you have the appropriate PPE in your office in accordance with CDC guidance and OSHA standards. And you want to make sure that you have at least 1 week's supply of soap, paper towels, hand sanitizer, cleaning supplies, and masks. And I realize that is just one of those things that is just really difficult to get a hold of right now. I feel like we have one employee at our clinic whose full-time job is to only look for these supplies constantly and be ordering them or running around town and picking them up. Next slide. So this is an example of a really great sign that you can have in your office, that you can have at the door to notify your patient. If you have any of these symptoms, please call our office before coming inside, because you want them to be aware before they, again, come in and start coughing on everything, and your staff has to stop what they're doing and cleaning it up. We even have some that have, we have funny signs in our restrooms that talk about hand washing for how long, and using soap and things like that. And again, common sense. We all know this. However, it's just good to have that in place because let's be honest, we've all been in a hurry and you kind of like half wash your hands. Like you just put a little bit of soap on there, you run some water over it, you dry them off, and you keep on going. But right now we want people to be very mindful of making sure that they take these steps and that they're doing everything they can to protect themselves and as a result protect our staff. Next slide. So then it comes to cleaning and disinfecting. So part of your compliance is that you're going to want to document these compliance efforts and what you're doing. You're also going to want to download the recommended use for disinfectant from the EPA website, and I'll show you what that looks like. Make sure that you're using the recommended cleaners that are available during this pandemic, and you're going to want to follow the instructions on safe use and effective use of those disinfectant products. So next slide shows you what, if you input the EPA registration number on the EPA website, it will show you what it is. So for this one, it's an example of Clorox disinfecting wipes. The contact time, it needs to sit on the surface for 4 minutes. So if you're using a Clorox wipe to wipe down an adjusting table or your countertop, it needs to sit there 4 minutes before you touch it again. It's really simple to look these up on this website. You can see it here, epa.gov. And you can scroll to the bottom and see everything listed, or you can actually hit EPA registration number Lysol, EPA registration number Clorox disinfecting wipe on Google. It'll give you the number so you can easily look it up and see what this information is. And it's a great educational tool for you and your team. Next slide, please.
You know, Christi, I was going to just interrupt a little bit here. Being in practice for many years, and a lot of doctors on the line probably relate to this. Wait, I didn't go to chiropractic college to learn what, how long Clorox or Lysol has to be used, so I know many of you are going, man, what a pain in the butt. I got to figure out how long, Clorox could stay on the surface, and I got to read all the labels on all my disinfectants and sanitizers. It's not fun. This is not enjoyable stuff. However, this is the stuff that we're dealing with right now. We're dealing in a situation that we've never had to deal with before. Many doctors are saying, it takes me 15 minutes in between patients to clean the rooms. Yes, I know this is, who wants to read about, the EPA registration number on Clorox and Lysol, right? And all these different things you can do. So please understand, we're all in this. We all need to do this. It's not fun. Some of you go grocery shopping, normally before, I call it, BC and AC, like before Corona and after Corona. Before Corona, you just go shopping and you just put your stuff in the refrigerator. Now, many of you bring home your groceries, you're wiping down the bags, you're putting on your gloves, you're putting a blue tape on your kitchen counter, clean stuff, infected stuff. I understand this is not fun. So I just wanted to interject and let you know that we all have this pain going on about dealing with this. So I just wanted to share that. You can continue now, Christi.
Well, I was going to say, I love that you did say that because I feel like in all of these conversations that we're having, because you also were doing a lot of webinars helping to educate your clients and doctors too about all of these different steps we're having to now take during these crazy times in our life. Everything is taking longer. And if we thought that we had a lot to do before, especially your team, they always have a lot to do. I feel like the person who sits at the front desk, nobody can multitask in this world quite like the person who sits at the front desk. And now we've just added all these additional steps for them. But it is for your protection and, again, for that of your patients, because it's only going to take one patient complaint. And I will tell you, I have a friend who's been going to the chiropractor for a really long time, loved their chiropractic office, and recently went in and didn't feel like they were taking the necessary steps to clean and disinfect the office. Like, it just didn't feel right to them. And that was the decisions they made to stop going to that chiropractor and go to another one. And that really resonated with me because I thought, wow, I don't know. Again, I work for our clinic, so I don't necessarily, these are those things that we kind of take for granted kind of in the background. And I thought, well, maybe I need to walk through our clinic and look at it through a patient's eyes. Are we taking those necessary steps? Are they seeing us doing everything that we can to make sure that this is a safe environment from them? And I don't know that I would have thought about that had somebody not shared that with me and told me about their particular experience.
Yeah.
So, and this is a compliance matter. I know how much y'all love compliance. I mean, it sometimes feels like a four-letter word. It gives you a little bit of heartburn. But we do need to document every step we're taking to clean and disinfect the office.
Yeah, I
So
was going to add,
even if,
when it comes to, like, clinical decision making, CDM, I call it, clinical decision making, or medical decision making, or chiropractic decision making. I came up with a new term. It's also called CDM. It's called Corona decision making, CDM, because I'll give you an example. My wife, she wants to go get her hair done. She wants to go to a hair salon or nails. I'm not sure exactly where she wants to go, but there's a couple of places where she wants to go. One place on their website has all the detailed information. We're going to be disinfecting. We're going to be sanitizing. You're going to stay 6 feet away. You're going to need to wear a mask. And the other salon didn't have any of that stuff. So here's where Corona decision making came into her, decision was, I'm going to the place that on the website it talks about all these precautions and these action steps they're going to be taking, and the other place seemed a little bit lazy. So Corona decision making, I'm going to go to the place. Same thing, eventually we're all going out to eat, right? Many of you might not want to go out. Whoa, the restaurants are open in my town for dine in. Okay, great. Are any of you going? Maybe you are, maybe you aren't. That's Corona decision making. The restaurant, are they cleaning the tables? Are the waiters and waitresses wearing masks? What's their, or is it one of these like rinky-dink, places where, the waiters and waitresses are, they're not wearing gloves, they're not wearing masks, they're taking the pitchers of water in one hand, they're giving it to another person, and you're witnessing this Corona decision making. Uh-oh, I think I'm getting out of here. So just a couple of things that, I wanted to share. Back to you, Christy.
well, and I love that. So I have a friend who owns a vet clinic, and one of the things that they did when they, while this was going on the last couple of weeks, is the owner filmed a video, and it was from walking into from the parking lot going inside to their vet clinic, and somebody greeted them at the door, so they didn't have to touch the door. And they walked in, and they walked them through the entire process about what it was going to be like when you brought your beloved fur baby into their office, what they were doing to protect you and to protect your little fur ball as you came in and as you left. Everything, every step, that you wouldn't have to touch a pen, that when you came in, they were going to text you from the car to let you know it was time. They were going to open the door for you and take you into the room. how they cleaned the room before you came in there. And then when you were leaving, they were sending you a text message so that you could pay for your vet bill over your phone. So at no point did you have to touch anything going into the clinic or out except for your beloved animal. And then it showed how they cleaned the room again after you left.
Right.
And
like
I
that.
thought that was so incredible, because how reassuring is that? And ironically enough, that's what my gym does. That's what they, my husband and I were kind of on the fence about whether or not we were ready to go back to the gym when it reopened. They post videos all the time. And in fact, I've seen it with my own eyes. As soon as you get off the machine and you clean it off, somebody comes behind you and cleans it again. And then they set a timer on it. When the timer goes off, it's free and you can go back and get on it. Because again, they've downloaded these 4-minute timers. They know, so if I wiped it off with Lysol wipes, it takes 4 minutes. When the timer goes off, you can get on the machine. And
Right.
everybody observes that. They have stuff separating it so that no two people can be any closer than 6 feet apart, or closer than 6 feet apart throughout the entire gym. And it's very reassuring. So one of the things you want to do is make sure you have this daily cleaning checklist, and that, again, even if somebody's coming in and cleaning your office at night, you pay janitorial staff to do that. You didn't witness that, and I am one of those people. If I didn't see it happen, it didn't happen. So I'm going to take the necessary precautions to make sure that I take care of it. And we're going to wipe down the front door handles. We're going to wipe down the front desk, the chairs. If at all possible, any electronic, if you still have, like, where people sign in, one friend of mine, they have a place for clean pens and dirty pens. So you use a pen once and it goes away. But if you can avoid having them do that altogether, not touching iPads, keyboards, not having them touch the credit card processing machine, anything that you can do to avoid them having to touch anything in your office until they get on your table or go into therapy. Just avoiding having them touch anything at all is ideal. But you want to make sure you're documenting it. Who cleaned it? What time did they clean it? And keep that in your OSHA compliance manual. The other thing, next slide, please, that you're going to want to do is that you need to take the temperature of every single, oh wait, that's not on the next thing. Sorry, daily checklist. So you're going to want to do team screening. Then I guess that was right. We can go through that one again. I'm sorry, Marty.
This one?
Sometimes I'll just grab onto a thought and I just go with it.
Okay.
So you're going to want to check them, and twice a day at the beginning and end of each shift. Every single person who works in your office, doc, that includes you, every doctor, every staff member, we want to take their temperature. We want to document it. Are they having any of these symptoms? Are they currently waiting for COVID-19 test results? Had they tested positive for COVID-19? You're going to want to document this and place it in your file, and document that you did check them constantly, beginning and end of each day, for their protection, for your protection, and to protect your patient. Again, we know there's lots of asymptomatic patients out there who could be spreading COVID-19, could be exposing you and your team, and you may not be aware of it until somebody becomes symptomatic in your practice. So we want to make sure that we're completing that daily checklist every single day, that you're doing your patient screenings, and that you're taking the temperature of your patients as they come in and documenting the results in their health records. And that you're, again, completing all of these checklists, and that you're documenting it so that in the event that you were to be audited or investigated, because, again, that is always a possibility, but you want to make sure that you have the documentation that says we're doing everything right. I trained my team. It's documented right here. We clean our office. It's documented right here. We look, screen every patient that comes in. It's documented right here. And that you're covering your assets and protecting yourself, your practice, and your patients. So, and again, if y'all have any questions, you can always reach out to us. We have tons of COVID-19 resources, including educational and marketing materials that you can use on social media, just to show that you're taking those extra precautions in your practice. And you can find those at kyrahealthusa.com/COVID-19. And of course, you can email us, call us, or even use the live chat feature on our website if you have any questions whatsoever.
Okay, Christi, excellent. Stay with us because we're going to get back to you. There's Kyra Health USA contact information. Basically, to sum it up, Kyra Health USA allows you to have a dual fee schedule legally, if I had to, sum up what they do. So if you're billing your PI patients $250 a visit, and here comes a cash patient, and you want to do the same thing, but only charge like 40 bucks, can't do that. You can't go from 250 to 40 for the same services in most states. It would be considered a dual fee schedule. So how can you do it? Kyra Health USA, discount medical plan organization, allows you to do that legally. And we'll get into that a little bit more when we finish today's presentation. But now I'm going to talk to you about HIPAA and Corona. There's a lot of scams going on, tons of COVID-19 scams. Whenever there's something going on like this, you have criminals trying to take advantage of people. So scammers have been hard at work coming up with new and unique ways to trick unsuspecting individuals with COVID-19 scams. They come in all different sizes and shapes. Phone scams, phishing emails, which we're going to get to in a few minutes, have become very, very popular. Cyber criminals, they're impersonating themselves as the World Health Organization. Imagine that. You get an email, you think it's from the World Health Organization, but it's a scam asking you to download an attachment or click on a link. You know what could happen if you click on a bad link or a criminal link, they can take over your computer. Yes, if you click on something that's a worm, a virus that can sneak into your system, you don't have good protection, antivirus protection, you click on a link, a scammer could now take control of your computer and steal all your information. Scary. A little bit about HIPAA and telehealth. When the public health emergency, the COVID-19 pandemic came out, the federal government said, we want to allow providers to do telehealth. So we're going to allow providers to use Zoom, FaceTime, Skype, those non-HIPAA secure platforms temporarily. Under normal circumstances, if you wanted to communicate with a patient, you can't use Zoom or FaceTime or Skype. You need to go through a complete HIPAA risk assessment on any company that has access to your patient information. So again, temporarily, you could use FaceTime, Zoom, Skype to do telehealth consultations with patients. But try and switch to a HIPAA secure platform as soon as possible if you're going to continue to do telehealth. What does that mean? Make sure they're a HIPAA secure platform by asking them for a BAA or give them a business associate agreement. Now, the federal government doesn't endorse typically any platforms, but they recommend or they list a few vendors that they say are HIPAA compliant and will sign a BAA. Skype for Business, VC, Zoom for Healthcare, Doxy.me, that's a good one. You can get started really quick and inexpensively with DOXY.me. Now, during this pandemic, you may have staff members working remotely. Here's another possible HIPAA problem. You have CAs that have never worked from home. Now they are working from home. They're logging into your computer. What systems do you have in place? You have to make sure that your CA's computer has the proper encryption, is locked. If you have a CA that has maybe a 16-year-old child that could be a little mischievous, and you leave your computer open, and your 16-year-old comes up to your computer and starts stealing patient information, crazy things like that happen. So you want to change your default Wi-Fi router passwords, ensure your local router antivirus software is up to date, ensure all personal devices are secure with company provided or personally owned antivirus software. You're supposed to have, according to HIPAA, this is a requirement, which I would say 90% of you do not do, even though it's mandatory. And it's kind of funny, Chris, you may have heard this when doctors talk to you. I want to make sure I'm doing everything right. And then I go down my list of what you need to do to make sure you're doing everything right. And the doctors oftentimes say, I don't think I want to do everything right anymore. So what you're supposed to do is have a policy on bring your own device. Like I have a client, he has 8 associate doctors. Every one of these doctors have their own iPad, and they can log in from home after hours. So there's a bring your own device policy that's required. Be extremely cautious of email phishing scams. There's a lot of these email phishing scams. How does it work? Cyber criminals send emails claiming to be from legitimate organizations. Now, doctors, you might be really good at being able to determine whether to open an email or click on a link. Do your staff members have that knowledge where they know whether or not to click on a link on your computer? So be wary of unsolicited attachments. They can spoof you into thinking it's a real email, and then they can take over your computer. Here's a couple of examples. It may look very legitimate. This is from some CDC health alert. The Centers of Disease Control continue to closely monitor. And what this scammy email is trying to do is get you to click on that link. You click on that link, your whole computer could be taken over by someone from another country, and they can hold you ransom. Don't click on these links. There's another one. What does this say? Go through the attached document. Safety measures regarding the spreading of coronavirus. This little measure can save you. Use the link below to download a safety measures from a specialist on Wuhan virus. Right away, these, scary. Here, all due to the coronavirus outbreak, we're actively taking precautions by issuing a communicable disease management policy. They just want you to click on a link. Here's another one. I got this one. This has nothing to do with Corona. I got this a couple of months ago from Netflix. I use Netflix. I love Netflix. I don't think I can live without Netflix. I am binge watching like crazy lately. So I get this email that says your Netflix account is on hold. I almost freaked out and passed out at the same time. What? I need my Netflix. What is this? And I'm looking at it. It's a scam. Hover your mouse over the link. This doesn't take me to Netflix. This takes me to some scammy company trying to get me to buy something or take over my computer. We are having problems with your current information. We need your help. Your friends at Netflix. Oh yeah, my friends at Netflix. Here's another one I got. I use Wells Fargo. I get this email from Wells Fargo. Right away, I know it's strange. Look how they spelled Wells Fargo. It says greetings from Walls Fago Bank. I mean, come on. If you get something like this, or your CAs get something like this, please do not click on the link. What the hell is Wells Fargo Bank? So regarding HIPAA, put together a HIPAA program. If you don't want to use us or any other outside company to put together your HIPAA program, start doing it yourself. Go to this website, HIPAA for Healthcare Professionals. Start putting together a HIPAA program for yourself. If it becomes overwhelming, then look for help. You need to do a security risk assessment when it comes to HIPAA. That's one of the most important things. Here's our little HIPAA checklist. Designate a compliance officer, create policies and procedures, start with that HIPAA risk assessment, identify your business associates and get your BAAs updated, conduct formal staff trainings and log those trainings in your HIPAA policy manual. I know Christi and I have been talking about policies and procedures and manuals. It's not fun. I know you didn't go to chiropractic college to write a HIPAA manual. I understand. Hire somebody to do it for you if you don't have the time. We all make mistakes. I recently bought a barbecue and I said, I'm going to put it together. I brought it home and, 2.5 hours later, I'm up to step 2. I have screws and nuts and bolts all over the place. Why am I dealing with this? I tried. All I need to do is hire Home Depot for $40. They came to my house and put the whole thing together in 20 minutes. So if you can't do it yourself, seek outside help. Here's something that I wanted to share with you, Christy. This is, and everyone, this is our internal policy and procedure on COVID-19 we put together for our clients. If anybody wants a copy of this, just send an email to info@targetcoding.com, info@targetcoding.com, and we'll send you this. It's just our basic policy and procedure. We broke it down into 3 categories. For patients, I mean, Christy went through all of this. So for patients, it says, we're going to temporarily discontinue the use of paper sign-in sheets. We will electronically check patients in rather than sign them in. This minimizes touch to papers, clipboards, pens. If electronic sign is not available, we'll have single-use sanitized pens. Yeah, I went to um, a restaurant recently to get food, and when I walked into the door, it's just takeout. They had a cup. It was labeled sanitized pens and like dirty pens, I think it said. So you take the pen out, you sign, or bring your own pen. Have your patients bring their own pen. So I have a whole bunch of things here. We encourage patients to sanitize at check-in. We're going to try to avoid scheduling too many people. We're going to discourage patients from bringing more than one person with them. We're going to, block off our chairs. We're going to remove waiting room material. You don't have to do all these things, but I think this is about, remember the CDM, Corona decision making. If your patients come into your office and you have stuff all over the place and people are touching things and nobody's wearing masks, there's a chance these patients are not going to come back in. So, these are the things that will give patients, that encouragement to come in. We're going to remove waiting room material if that's the case. And then for employees, we'll enforce social distancing. We're going to discourage sharing computer keyboards, touching screen monitors. Again, wow, I didn't even think of that. Your staff members, they share one keyboard. So, is that something you want to continue to do? You're going to wipe down the keyboards? All these things that you may not have thought of until now. Does your staff bring food for lunch? So we have a policy on that. And then just general, we sanitize equipment, we disinfect the doorknobs and handles and light switches, we wash our hands with soap and water. Staff will use sanitizer prior to and treating every patient. We make good faith attempts to use EPA approved cleaners, wear gloves. So just a few closing comments. Let's see. Christy, anything you want to mention as we end today?
No, I love that, and I love that policy that you have written out. And I think that again, even if you're not familiar, I mean, like comfortable with social media, I can almost bet that you have at least one person on your team that is. And having them do a video that explains all that, show your waiting room where you've removed all those items. We did remove all of those items from our waiting room, and we actually removed chairs. And so we have a very small waiting room as it is. And so there's like 2 chairs in there. We don't allow anyone to bring a guest in with them unless they, some of our older patients have someone who comes in with them because they need help. And if you have to bring your kids with you, that's understandable. But we used to have toys in the waiting room so that children could play while their parents were getting adjusted. So the parents could get adjusted in peace. But now if you bring your children in, they have to come into the room with you. And we try to minimize that touching as much as possible. And so if you do treat a lot of families, make sure you're going over that and just say like, hey, mom and dad, y'all can all come in together as a family. You're gonna wait in the car until you come in, and then we're gonna take you right back, get you adjusted, and get you right out for your safety and those of others. I can't impress upon you enough the importance of letting your community know the steps you're taking to keep them safe.
Yeah, and I've heard a lot where, yeah, we're going to have our patients wait in their car in the parking lot until, we're ready for their appointment. I have many, many clients in big cities where they are on the 32nd floor of an office building. For example, in Manhattan, I have many clients in New York City. I have one client, he's on the 52nd floor of an apartment building, of an office building. He can't have, there's no cars. He can't have his patients wait in the car. There's no car. It's Manhattan. It's New York City. So he has to take other action steps where patients are going to be waiting outside in the lobby area until it's time for them to come in. So I feel your pain. I hear your pain. I know that this is not easy. I know, yeah, what if the patients wait in the car and do this? It's not that easy. I understand. Try your best. Be logical, be sensible. The three basics, masks, gloves, and social distancing. So I just wanted to thank everybody for attending. Let's see what questions have come in before we end here. Okay, let's see. Okay. Um, Christi, first question is for you.
Okay.
If my patient, if I use Cairo Health USA and I am if the patient is in another state, is that appropriate? I guess what the doctor is saying, let's say the doctor is in Mississippi, has a practice, signs up for Cairo Health USA, and the patient is now living in another state. Let's say they drive, you know, like I don't know about in Mississippi, but in New York, you could be right on the border with Connecticut and New Jersey. So I guess what the doctor's trying to say is the patient lives in another state when the doctor practices. Is that does that work with Cairo Health USA?
Absolutely. Um, and we border Louisiana, Alabama, um, and Tennessee, and so we have lots of practices, even in Mississippi, that see patients that live in other states. Additionally, too, you have patients that travel. So you may have, we actually have one patient that utilizes Cover Health USA and has for years, that lives in New York and has a chiropractor in New York that's a telehealth provider, and a chiropractor in Florida that they see when they're in Florida. And so what's interesting how we found that out is because sometimes they renew their membership in New York, sometimes they renew it in Florida. But these two doctors share this one patient because they spend so much time traveling between the two states that they have a provider in each state. So it's perfectly fine to have patients living in a different state than you that you have a chiropractic
I just thought
membership.
of a question that you mentioned that does the patient have to pay two different fees if they're going to two
No,
different chiropractors? If they're both in Chiro Health USA, does the patient have to pay the same fee twice?
no. So their membership fee is good. They can use any of the 5,000 chiropractors in the entire network,
Okay,
in 49 states. So
got it.
one membership is good for exactly 1 year, covers them and all of their legal dependents. Another way that you would see this happen too is that parents who have kids that are in college that are out of state, their kids would be covered under their Cover Health USA membership, but they may live in Mississippi and their kid might live in Georgia and see a chiropractor there, but that membership would still be good in Georgia as well.
Okay. Next question is, where do we find the wipe information? The wipe information? I like that question. Well, if you want, I could, at the bottom of my policy here, I have all these different links. This is where you can find, the disinfecting and the wiping information. And I think Christy also had it in her slides. So yeah, you could also ask your state association. Which types of masks are okay to be used by docs in the office? See, I'm not a mask expert. Christy, do you know, like, should I guess the doctor, has an option to wear just a regular disposable mask, an N95 mask, a motorcycle helmet. I don't know what the doctor is going to wear, but do you have an answer to that? What type of masks should the doctor wear?
So I think that in the beginning, the CDC guidelines were a little bit more stringent. At this point, they just want you to wear a mask. So we could not find, we ran out of N95 masks pretty early in the during COVID-19. And so all of our doctors are wearing masks that we paid somebody to make for them right now that are washable in the practice until we can get masks, which our last order that we placed a month ago says that they may or may not be delivered in July.
Mm,
Um,
okay.
so I think If you can get N95, that's great. If you can get surgical masks, that's great. If you can't do any of that, there are people all over the country who are making masks for healthcare providers. Just have something that is covering your nose and mouth is what's essential.
Correct.